Hi, friends. It's Beth here with Aging Care Solutions, offering experience guidance, professional family caregiving experience, and a lot of life under my belt. So, I feel like I've run into so many different scenarios, not only in my professional life, helping families, but really helping my own family, helping my mother when this situation would happen. And one of the things I wanted to try to do is not only am I sprinkling in certain things, like my last video was about problem solving and why it can help be like a superpower of ours as we age. I am sprinkling in things like this topic, which is the Medicare guidelines on returning to subacute rehab. If you've ever been to a rehab facility, like a skilled nursing, what we used to call a SNF, skilled nursing facility, after a hospital stay, and they were doing more intensive therapy with you for physical therapy, occupational therapy, speech therapy. A lot of people aren't aware that if you go home and you have a setback that is directly related to the reason that you went to that rehab after your hospital stay, you can return to that rehab facility and pick up the benefits that are still pending. So Medicare basically allows a person to return to a subacute rehab or a SNF within 30 days of discharge. It can still be covered under the same benefit period, but there are specific conditions that apply and in order for these guidelines to be met. So I'm going to talk about these today because there's been many, many times over the years that I have met with families and I would go to their house setting up services, and they could be under the care of a skilled care team. So they could have a nurse going in and doing wound care or just nursing oversight. They could have a physical therapy team already in there. But say that they had a fall and broke a hip. They had a 3-day hospital stay, which qualified them to go to the skilled nursing facility for rehab. But when they got home, they had another fall, or they had a secondary infection that set in, or something that was related to the reason that brought them to the rehab facility in the first place. That 30-day readmission would apply. So if the patient has to return within 30 days, they do not need another 3-day hospital stay. Right? But the return has to be related to the same condition that they were previously treated for. Just so many people, and I would see people go home and I'm like, I think you need to go back. I don't think you've had enough time, but if you've ever had to stay at a rehab facility or a SNF, a skilled nursing facility, it's the last place that anybody who's not feeling well wants to be. Some of them are great, and some of them are hellholes, if you ask me. And I've been in 38 of them in the county that I live in, and I've been in another, I think 37 in the adjacent county north of me, but I've been in 2 other counties as well. And there's probably 3 or 4 dozen in each of those other counties, and I've been into every single one of them. And some of them are great, and others I wouldn't send anybody that I knew there. But, unfortunately, we just have to be as discerning as we can, especially when you are at a hospital. And I'm empowering you to ask a lot of questions on behalf of yourself or your loved one. When they hand you that list, when that discharge planner or your case manager nurse is working with you over the course of your stay, and if your doctor, if they recommend that you go to subacute rehab and they give you that list, don't take the very first place that they recommend. Do your own little research, get your smartphone out, or have your daughter or son start looking. What are the star ratings? How far from the house or from my daughter or my son is this subacute rehab or this SNF going to be? How far will they have to drive to come and see me? I mean, I've had people that I said to this one lady, why are you here? You live in Baltimore County. Why didn't you she said, well, they didn't really give me the options to go back. I said, okay, not for nothing, but your husband could be visiting you right after work every single night instead of driving an hour to come see you. So she had a car accident in this county, and they kept her at a local hospital. And instead of trying to get her closer, they took the first available bed in a, So anyway, my point is that we really should need to be our own advocate for all of this, and knowing that you don't have to take the options that they're recommending. And if you have a laptop, if somebody can bring you your laptop or even your smartphone and you're able to search, just look them up. Look up the star ratings. You can go to Medicare and look at what the reviews are showing about some of these places, and you can make your decision at that point. But the person, to go back to this, is within that 30-day rule of readmission, there has to be a need for skilled care, right? The person must still need meet the criteria, Medicare's criteria for skilled nursing, physical therapy, wound care, IV medications. The condition must require daily skilled nursing services or oversight that cannot be provided at home. And then the resumption of SNF days means that the SNF stay resumes where it left off. So if you had, you were into Part A covers 100 days. I'm not even sure if you're aware of that, but Part A of your Medicare will cover up to 100 days per benefit period. So in a year's time, you are allowed 100 days in a SNF, in a skilled nursing or rehab facility. If, however, you went home after 21 days after your fall and your hip break or your surgery, whatever it was, and you used maybe say 10 days or 21 days of that, when you return within 30 days, that will start from that next day. So if you stayed 21 days, you would be on day 22 of your Part A coverage under your Medicare. So you would have a lot of time left to be able to go back and regain your strength. Nobody really wants to be, I don't know. I used to go in and visit people, and I would do whatever I could to cheer them up. Ask them if there's anything I can do. Do you want me to wheel you out? Want me to help you get off, out of the bed? Do you want me to FaceTime your daughter with you or son so that you can talk to them? I don't know. I just wanted everybody to do the best that they could while they were in these places, because it's not fun. I know it's not fun. I was in, as you know, I just told you how many skilled nursing facilities that I've had to be in over the years. And, it's not fun. It's just not. I would encourage you to get out of your room, go to the day room, go wherever there's activities. If you can participate in anything exercise related or engagement related, if there's a room where they're doing cards or puzzles or anything, don't sit in your room all day long. It is so depressing. Sometimes there's an outdoor atrium. There's sometimes is an outdoor area where you can get fresh air and sit among the trees and the landscaping and the birds. So I would encourage you to do that, especially if you've got another 5 days, 8 days, 10 days, whatever it is. But going back within those 30 days, there does not require another hospital stay. So unlike the initial admission, which required a 3-day inpatient hospital stay, readmission to a skilled nursing rehab facility within 30 days does not require another qualifying event, another qualifying stay at a hospital. So it's unknown to a lot of people. Like, a lot of people aren't even aware of it. Or if you were told it, maybe you weren't feeling well, or you were under anesthesia, or coming, just getting your bearings and understanding. But a really good home health agency will tell you this. They really will. I have a lot of friends that are still in home health, and we would tell people. We absolutely would tell them, look, if you get home and you start to decline, or you are becoming more and more weakened, really their team should be working on that. They should be getting home health services at home. But I've known people to turn people away at the door. Their therapist comes, no, I don't want to see anybody today. Don't do that. Don't do that. If you do that, Medicare will not cover it. If they see that you've turned a physical therapist, a nurse visit, a wound care visit, speech, they're sending out people who are billing Medicare for those services. And if you decide you don't feel like it, that day, you don't want to see somebody, you don't feel up to, no. They will, they'll stop those services. And sometimes they can not give you those services if you keep doing it. You will kind of forfeit the services that you had under that particular illness. So I'm telling you to please, if you know they're coming every Tuesday and Thursday, get up. If you can get yourself dressed, if you can do what you can do, just do what you can do to have them come in. But it has to be under the same benefit period. So when it is, if this benefit period starts the day after the patient is admitted to the hospital and ends when they haven't received SNF care for 60 consecutive days. So if you go home and it's 60 or more days after the event that brought you to the rehab, then unfortunately you are out. You have to have another hospital stay. So it is important to, timing is everything. And, the hope is that when you do get home, you are still recovering, and that you're going to get stronger over the weeks, days, and months that are going to go by. But it's going to happen by doing the work. And going to these subacute rehabs and these nursing care facilities, it's going to require that, yes, you're going to be in pain, especially if you fell and broke a hip, or especially if you had to have a knee replacement, or you had a terrible infection. Just like any of us, we have to push through. We have to continue to challenge our bodies so that you're going to regain your strength. You're going to regain your balance. You don't want this to be your new normal. You don't want to be where you are dependent on everybody else. You want to learn how to use that walker, how to do the exercises that they're telling you to do in between your visits. Because, like I said in my last video, nobody's coming to save us. You are your best advocate. You are the one that's going to say, look, I've been through this in my past. I know I can get through this. And I'm going to do my very best to challenge myself every day to hydrate myself, make sure that I'm eating healthy and taking the medications when I should so that my body can best respond to it. And when my therapy people show up or the nurse comes to see me, I'm there. I'm grateful to see them. I know that they're there to help me, and I'm going to be a compliant patient. Important considerations in regard to all of this is that the patient returns after 30 days, a new 3-day hospital stay would be required if it is a different condition. So say you go home because you had your fall, you broke your hip, you went in, you had your surgery. At discharge, you went to subacute rehab. But if you went home and something else happened, whether it was related to, say you had unfortunately had a stroke, or maybe a cardiac issue, or you got, pneumonia or something else, then another 3-day hospital stay would be required, right? So if the patient goes more than 60 days without hospital or SNF care, a new benefit period starts. So you're resetting that 100 days coverage, but you're also required to have a new hospital stay. So, but if you're bad enough, you're going to know that you have to go, especially if you're in distress. I mean, my gosh, there comes a time when we didn't know that we need help from others. And we just have to do what we have to do to take care of ourselves. And obviously the skilled nursing facility needs to, and they must document the medical necessity and ensure the care that is for the same or the related condition. So they'll document all of that. Your care manager, they know. They all want to stay compliant, believe me, at these facilities. So they're going to make sure that if you are readmitted, you are coming back, you are working with the same people that you saw weeks earlier, that they are aligned with the number of days. Their MDS person that's managing the services and the coverage for you they'll make sure that it's all on point. So an example scenario of this is that someone named Mary is discharged from subacute rehab on July 1st after 15 days of care for a broken hip. On July 25th, she fell again, and her doctor recommended that she return to rehab for more therapy. Because this is within a 30-day window and it's still related to her original condition, Medicare will cover this for her return to the skilled nursing facility, and it's going to pick up on day 16 because she was already there for 15 days. Okay, so she is within her benefit period, but it is going to pick up because it's the same condition. So no new hospital stay would be required. So I hope this was helpful. You know, you can simply go onto the Medicare guidelines page and look all this information up. But I think because I've been in the industry, I always try to tell people, you know, like if you go home and you decline for whatever reason, or there's an infection related to what brought you to the facility, you can go back, and like I said, a good home health agency is going to notify you of that, and they would recommend it. They'll tell you or your spouse or your children, your adult children that are helping you, or even the people that, you know, are managing in your building. They'll tell them, look, you know, this patient's got X number of days. If they don't seem to be bouncing back, let us know. So I hope this was helpful. I'm trying to bring as much helpful content to my viewers as I can. But as you know, I'm moving, and so things have been a little crazy in my life, but that's okay. Things are going to settle down, and I'm also going to start offering, once I get settled and I get an office back, I am going to start offering consultations so that I can really get, everybody's case is so different, and everybody's family and dynamics and situation is vastly different. So I'm here to help, and that's really what I'm going to be doing, is trying to help figure out what resources that are out there, whereabouts do you live, and let me do a little bit of legwork for you so that I can make and help you make an informed decision about what you need. So I hope this was helpful, and I want to send you all the very best and a big hug as you take care of yourself and when you navigate the care journey for yourself or your loved ones. I'll see you at the next video.